Hey guys, so I wanted to make a video. Um, well, first of all, thanks for checking out my video and coming to my channel. So if you haven't already, subscribe, like. I'm trying to do videos more often. But this video I wanted to make about what being a new nurse entails and what they don't tell you, because I feel like when you're a new nurse, like you're like hype, you're like, all right, like, you pass your NCLEX, you got through nursing school, and you're just excited to start working, and there's like a big transitional period. So don't mind if I look down, because I have like everything written down on my phone, because I don't want to make this video that long. But yeah, so basically the so I just want to say, like, I'm on a med surg floor. So if you haven't seen my previous videos, I'm on a med surg floor. Being a new nurse, so I'm a new nurse. So I started March 4th, and so I'm almost in the 2 month. I guess I'm still like a month and maybe like 3 weeks or something like that. So yeah. So what they don't tell you is it's like a huge like shell shock, like starting as a fresh new grad nurse on a unit. Like, it's a shell shock. The transition bit from nursing school to the unit is huge. Like, it's not like clinicals where you do like two little things, but everything is on like the clinical instructor. No, like now it's like, all right, this is about to be you. Like, these is about to be your patients. So yeah, so the shell shock, it can be overwhelming. Like, I feel like when I started, I'm like, oh my god, like, am I even gonna know all of this? Like, like, I was stressed like every day. Like, my friends, family, they'll be like, so how's it going? And I'm like, I don't know, like, I can't tell you, like, I'm stressed out, like, you know what I mean. So I would just say, like, give yourself time. Yeah, like, just give yourself time, and just know that as more time goes on, you're gonna be more proficient at what you're doing. Also, I wanted to say, like, this is the time where it's like survival of the fittest. So it's either you make it or you don't. It's like when, like, making a team almost, I think. Because from like what I've heard, like from what like previous nurses on a unit has told me, they're like, there's some people that came after a week and then they just walked out. And I'm like, oh snap, like, okay, like, first of all, like, I could never do that. You know what I mean? I work too hard, but it's different for some people. Like, some people are not used to the responsibility or used to the pressure, or some people just don't like that huge learning curve, because it's a huge learning curve. And maybe for some people, like, things just come so easily to them, and then like one little challenge, they kind of just walk out. So maybe that could be it too. But yeah, survival of the fittest. So this is during this time, it's you're gonna see, like, okay, if is nursing for me, or is it not for me? You know what I mean? So I think that's like, a huge point. So the tips that I have, as far as, like, with your preceptor. So I have one preceptor. I never like changed my preceptor or anything like that. My preceptor was fine. I would just say be proactive. Like, maybe like the first couple days, depending on how your preceptor is, she might, or he might, have you just watch them for a little bit, and then maybe like a week or something, or a couple days, and then after, they're gonna have you slowly start having you do like little things. But definitely be proactive and take the initiative. I feel like people who don't have a good experience with their preceptor, they're not proactive, and it's like, everybody's different. Your personality is different, the preceptor's personality is different. So of course there might be like a personality difference or clash, or whatever the case may be, but at the end of the day, you have to be proactive. Not everybody's gonna baby you, you know what I mean? And I feel like, sorry with the background noise, I feel like a lot of people expect to be spoon-fed, and no, like, you're not gonna be spoon-fed. I mean, you might find a preceptor who maybe could baby you a little bit, but at the end of the day, like, it is what it is, you know what I mean? So I feel like just be proactive. Any little thing, like, start little, like flushing lines, start little, even though you've done that stuff in clinical, but like, just to build that like little teeny bit of confidence in you, like, just to build it up. start small and ask a preceptor, like, oh, if you see the preceptor doing something, like, oh, hey, can I do this? Like, because they're right there. So just in case, even if you have a question while you're doing it or whatever, like, it's okay for you to ask them. Like, that's what they're there for. From there on, from that point that I just said, like, there's no such thing as a stupid question. Like, I ask questions all the time, like dumb questions, stupid, like, it don't matter, because at the end of the day, like, I'm not trying to hurt nobody. Like, I want all my patients to go home safely. If it's up to me, like, if I can, I'm gonna do the best that I can to take care of my patients while they're in my care. So always ask questions before you do anything. Always ask questions to know that you're doing it right. Also, it's okay if, like, you feel like you're not really getting much from your preceptor. You can always switch your preceptor, but I would just say to kind of leave that for last, like your last resort. It's always an option, so it's always there. But I would just say leave it as a last resort, because at the end of the day, the preceptor is there to teach you, and I feel like it's like a regular teacher. We don't like all our teachers, you know what I mean? And you may feel like, oh, well, my teacher is not doing enough, but then you start realizing, okay, if I start doing stuff, then that's when the teacher is really like, you know what I mean? So I feel like that's the same thing with your preceptor. Like, you may feel like, it might be some type of clash or whatever the case may be, but you just have to be proactive and, talk to your preceptor like, hey, can I, you know what I mean? Like, take on a patient or whatever the case may be. Like, for me, honestly, I was contemplating, because of changing my preceptor. She's nice and all, like, she's a great preceptor, but at first I'm like, oh my god, like, I feel like I'm not really doing much. I had a friend also who started the same time as me, and she was doing a lot, and of us, we were always comparing, and that's one thing you have to learn not to do. But yeah, so I'm like, oh my god, like, I'm not really getting anything. But my friend was getting patients. So I'm like, all right, let me, she was just like, maybe you should just see if you can get patients. So literally, like, the next time I worked, which was probably like 2 days later, I'm like, hey, can I start with like 3 patients or something like that? And she was like, yeah, sure, okay. So I started with 3 patients, and from there on out, I feel like our relationship got better because I was being more proactive. So that's just an example of, like, me just saying that you need to be proactive. So the next thing I'll say is tips to be successful. What I find for me that helps me out is, before I start my shift, I come in a little bit early, not crazy early, maybe like 10-15 minutes early. And I try to read up a little bit on the patients that I'm going to get for the day, because usually, like, the census and everything is already out, and the patients is already there maybe from like 30 minutes before. So I try to come in and read about my patient, because I'm new, so, like, I'm still trying to get, like, the routine and everything down pat. So I feel like with me reading up on the patient, I can kind of put, like, the puzzle pieces together. I could put things together, and it would just, like, start making sense to me. So that's a tip that I would say, is just to try to come in early and try to brush up on your patients, read their labs, what needs to be done, if there's anything out of whack, before you get report, because you're gonna get report anyway. But even so, while you're getting report, you always want to look at your patient's chart and stuff to make sure it's congruent with the previous nurse is saying, like the nurse that's going off. Another tip I think is, to have, like, an outline of how your day is gonna be. So some people have things that they print, and it has, like, everything printed out all nice and neat and whatnot. Not me. What I do is I'll just, we have something called Cardex. We have Cardexes, and then we have, like, a nurse's worksheet or whatever. So I'll just print out the nurse's worksheet, and literally on the back, which is like a blank piece of paper, I'll write down all the rooms. I'll write down the medications, the med times. So usually the med times I have is like 10, 12, 4, and 6. Let's just say that. So I'll write that down in the times, and then have, like, a little square empty box. And then once I'm done with that, I'll check it off. Like, okay, I did this. Also on that sheet, I'll put like the name of the doctor, like primary care, just in case, you know, name of the doctor. If they had any bowel movement, BGMs, I'll write that. I'll have a box for that. I'll have feedings, like if you have a patient that's on a peg tube or a G tube or something like that, the feeding times, if you know, if they're like bolus or whatever. And also I'll just keep like a blank spot where I'll like write my notes with like stuff that's outside of the basic. I feel like that's like basic, and then there's stuff that is outside of that. So if a console pop up, or you know, if you did a dressing change or whatever, like I'll just write that in my notes, or you know, just so like when I'm leaving and then the new nurse that's coming, the oncoming nurse, then I have like those little notes to say what I did for the day or what they need to follow up with. I have like little notes on that. Lastly, I think like the last thing I'll say to do as a tip is find time to document, and like, you know, during the day. So you know, everybody's always saying like, you know, organization, like even seasoned nurses have issues with organization. And I feel like it's very important to have to be organized, and I'm not the best organizer, but I'm trying to find just what works for me. I'll look at what like all the other nurses do besides my preceptor. Like my preceptor is always there, but I would talk to other nurses on the unit to see, you know, how they go about doing their stuff or whatever, because you're not going to remember everything. So you know, you have to know what time you did what. So usually I'll document like after I give meds in the morning, like my first meds. So if my first meds is at 10, I'll try to document, you know, a little bit after. So I'll document my vital signs. I'll try to do my assessment, but usually the assessment takes a while. So I'll usually keep that for like last. But yeah, so this is like right now because I'm working during the daytime, and I'm gonna switch to overnight. So that might be a whole different routine. So pray for me, because I don't know how that's about to be. But yeah, I don't know. These are just like tips that I have. Like I'm still learning. I'm literally only like almost 2 months and not even a full 2 months. So these are just like little tips that I had, and I feel like they don't really tell you, so to say, so to speak. But I just wanted to explain just like that transitioning. Like I'm going through it right now as we speak. And, you know, I kind of just want to put that out there because I feel like when you go on YouTube, it's kind of like, okay, hey, I went to nursing school, I passed my NCLEX, and then you see a post like 8 months later and they're like, yeah, my nurse, you know, is lit, like life is good. And I'm just like, okay, so what about that in between time? You know what I mean? Like nobody really, I feel like nobody really speaks about that in between time and how scary it is and how nerve-wracking it could be. But you know, I just wanted to make this video to let you guys know that it is nerve-wracking, it is scary, but just give yourself time and just be proactive. You know what I mean? Do everything that you can, get all the experience that you can on orientation, because once you off orientation, like, I don't want to say that's it, because you can always ask people depending on, you know, how cool like your coworkers are and how helpful they are. But you want to just make sure you get everything during that orientation, get all your hands-on experiences. Also read up on your policy and procedures so you know what to do and what not to do. You know, I feel like that's very important. But yeah, just know that you'll get there. If you're a new grad nurse like me and you're like on week 3 and you're like, oh my God, I'm stressed out, it's so overwhelming, it gets easier. And I'm here to tell you that. Like, it definitely does get easier. Like, you know, yeah, so that's it. So that's my, you know, quick little tips that I have. I try to make this video short, but it's about to be like 50 minutes. But yeah, so if you guys have like if you guys have any questions, suggestions on videos that you guys want me to do, I know it's been a while since my last video. It's probably been like 2-3 weeks, but your girl's been tired and stressed, and I started my online BSN program, so your girl's tired. But I'm gonna try to do these more often. I'm trying to do it at least like every week, every 2 weeks, do videos, give you guys an update to, you know, what's up. And if you guys have any questions, let me know. Subscribe below, like. You can always email me. My email is, I'll put it in the link too. But yeah, thanks for watching, guys. I appreciate you guys, and I'm here for you. You know, I'm a nurse just like you, and you know, I feel like we should just stick together. So, thanks again, guys, for tuning into my channel. Bye.